right. Okay. Today, as promised, we have the premiere of Dr. Ashish Jha, our new White House COVID response coordinator, in the briefing room. Dr. Jha will be talking about two important pieces of work in our we are working on with Congress. First, expanding access to life-saving COVID-19 treatments, and second, our urgent need for funding from Congress. He has time just to take a very small number of questions today, but he will come back soon, I'm sure. So with that, I will turn it over to him, and then we'll proceed with an oral briefing.
Good afternoon, everybody. Good afternoon. All right, well, it's great to be with all of you. A little exciting and a little scary with this crowd. So I want to take a minute to talk about where we are with the pandemic. I believe we are at an inflection point. One hand, we know that BA2, the subvariant of Omicron, has become dominant. Cases are rising across the country. But hospitalizations are at the lowest level of the pandemic, right? And deaths are continuing to fall. We're down to about 300 deaths a day. Still too many, still too high, but doing so much better than we have throughout much of this pandemic. Despite all of that progress, and I think a lot of that is driven by the fact that we've more than 200 million Americans vaccinated, more than 100 million Americans boosted, we know this virus is tricky. We know that the risk of potential surges, even of a potential new variant, remains out there. The good news is we are at a point where we have a lot more capabilities, a lot more tools to protect the American people. Testing, vaccines, therapeutics, these are the sort of the pillars of how we manage the rest of this pandemic. And that's why what I want to do is spend some time talking to you about those tools, about our capabilities, what we're doing as an administration, and what we need from Congress to continue to protect the American people. So first I want to talk about Paxlovid, the therapy that is becoming increasingly available to the American people. For those of you who have not followed this very closely, Paxlovid became authorized by the FDA in late December. At that point, there was just a very limited supply of these pills. The clinical data suggests that it has an enormously beneficial impact, reduces hospitalizations by more than 90%, and is very, very effective at preventing severe disease. Over the last few months, the administration has worked very hard with Pfizer to increase the supply of Paxlovid and acquire more and more doses for the American people. And now our job is to make sure that these doses are getting out there and they're getting into the hands of patients who would benefit from them. So what are we doing? And I want to talk about four major things. The first is we are opening up the number of sites that can order directly from the federal government supplies of Paxlovid. Until this recent change, the way pharmacies got Paxlovid, either you were a test to treat site or you got it from your state. But now we're opening up a federal pharmacy channel, and what that means is pharmacies can order directly from the federal government. Currently, there are about 20,000 sites in the United States that carry Paxlovid. We expect with this change that we will very quickly get to 30,000, and within the next couple of weeks, I expect us to get to about 40,000 sites. Paxlovid will be widely available everywhere in America. That's going to help a lot. The second is the president announced the test to treat effort that we have launched. Right now, there are about 2,200 test to treat sites across the country, and we are going to make a series of efforts to expand the number of test to treat sites, including new federal initiatives that will allow for us to build on other federal testing sites to allow for those to also have a treatment component. So if you test positive, you can go and get treated with Paxlovid, of course, if you are eligible and deemed so by a provider. Third is we really are doubling down on our communication and education efforts with physicians and other prescribers. In the beginning, when Paxlovid first became available, the word on the street was these things are now widely available. You should restrict it to the highest risk patients. Too many physicians still have that mindset. And what we need to do is to help American physicians and nurse practitioners and others who can prescribe understand that we now have plenty available. And anybody who is eligible, anybody who's high risk, should be getting Paxlovid, obviously as long as they meet the clinical criteria. And so that education campaign is going to be really important. And then last but certainly not least is we're ramping up our public awareness campaign so that patients also understand that if they test positive, they should consider going to a test to treat site or reach out to their physician, but to get assessed for whether Paxlovid would be useful for them. Those are all really critical steps that I think are going to make an enormous difference in getting more Paxlovid out to the community, to getting it out to patients, and with a very simple goal, right? Which is we want to lower the severity of the disease that people get if they get infected, and we want to lower the hospitalizations, we want to lower deaths. Paxlovid is a really important step in our ability to fight this pandemic. Treatments like these, vaccines that we have developed, these are the key essential tools that we're going to need to get through the rest of this pandemic. And that's the second part of the conversation I want to have with all of you. Because all of this requires funding from Congress. So far, Congress has not stepped up to provide the funds that are needed for our most urgent needs. Now, I know they were off on a 2-week recess. They are back. I'm looking forward to working with Congress, we all are, to get the funding needs of the American people met on this, on the issue of COVID and COVID treatments. Let me give you a couple of concrete examples of what will happen if we do not get the funding we need. You may have heard, if you've been tracking this, that FDA, working with Moderna and Pfizer, looking at what the next generation of vaccines may look like. And it is possible that we may get a whole new generation of vaccines in the fall or winter that may be more effective and more durable. None of those are going to be available to the American people if we don't get more funding. We are tracking new treatments that are coming online that are as effective, maybe even more effective, with fewer side effects. Those treatments will not be available to Americans because other countries are stepping up and making purchases for those treatments while we await funding from Congress. The bottom line is that none of us can predict with any certainty where exactly this pandemic is going, what the virus is going to do next. All we can do is prepare. And that's what we need Congress to do, is to help us prepare and be ready for whatever eventuality comes. Let me make one last point that I think is incredibly important. And that is that there are some people in this country who sometimes think that we can take a domestic-only approach to a global pandemic. That's not a thing. You can't do that. If we're going to fight a global pandemic, we have to have a global approach. That means we need funding to ensure that we're getting shots in arms around the world. The president and his leadership has enabled us to now have plenty of vaccines for the world. But vaccines don't save lives, right? Vaccinations do. We have got to finish the job. We've got to get the resources we need to get shots in arms so we can actually vaccinate the world and help bring this pandemic to a close. So those are the essential things that are in front of us. This will require a partnership between the administration and Congress. I am confident that Congress will deliver for the American people, and I look forward to working with them on that. Thank you.
Every time a high-profile person like the Vice President catches COVID for attention on the infection, for Americans following that news, what lessons should they draw from that experience that somebody as protected as her has caught COVID?
Yeah. Good question. So I think if you take a step back and look at the Vice President, she is boosted, actually twice boosted, right? We have a very, very contagious variant out there. It is going to be hard to ensure that no one gets COVID in America. That's not even a policy goal. The goal of our policies should be, obviously, minimize infections whenever possible, but to make sure people don't get seriously ill. The best ways of doing that are making sure people are vaccinated and boosted, as the Vice President is, and making sure we have plenty of therapeutics. So, so that is available as well. And that, to me, is the key lesson here.
And is she receiving any therapeutics, since we're on the topic of therapeutics?
That's a conversation that she's having with her physician. I'm not her physician. I'm not privy to those conversations, so I don't know the answer to that.
Thank you, Dr. Jha. Welcome to the briefing room, by the way. To your point that so many Americans can and will get this report that just came out today that 60% of Americans have had COVID. The president is getting ready to ramp up his travel schedule. The vice president just caught it. She's twice boosted. Should Americans be prepared for a time when President Biden gets this? Is it just a matter of time that the president could get COVID?
I wouldn't say it's just a matter of time, but of course it is possible that the president, like any other American, could get COVID. The bottom line is he is vaccinated and boosted. He is very well protected. He's got very good protocols around him to protect him from getting infected. But there is no 100% anything. And I think the key focus has got to be we've got to continue protecting the president. That's what the protocols around him are designed to do. Yeah, let me leave it at that.
Yeah, part of the congressional funding is to potentially deal with the uninsured fund that has run out of money. What does the uninsured fund not having any money in it mean for Paxlovid? Or if someone who's uninsured gets COVID right now, what does that mean for them?
Yeah, so first of all, Paxlovid itself will be free, right? Because
They have to see a doctor?
but they have to see someone who can actually prescribe it for them. And this is one of the absolutely critical things in a pandemic is that people need to be able to access healthcare. Turns out it's also critical not in a pandemic, right? But particularly in a pandemic with an infectious disease, it's really important that people be able to access healthcare services, get the care they need. It's good for them. It's good for people around them. And so making sure uninsured people have access is absolutely critical.
So right now, what does that look like? If someone gets COVID and they're uninsured, are they able to get treatment? Are they able to get tests? Or does CVS just eat the cost? How does that work?
So
right now?
I think right now, because we don't have the funding, there's a little bit of patchwork of what is happening. There are obviously places that serve uninsured people, community health centers, others people can get care. There are still people are still going to CVS and other places that still are offering those services, but that's not a sustainable solution, right? So right now we're in this kind of middle ground where people are still getting care, but over time, if Congress continues to not fund these urgent priorities, it's going to get harder and harder for people to access care.
Kristen?
Thank
Kristen has to
you.
be the last one too. I apologize. I'll be back soon. Go ahead.
Thank you, Dr. Jha. Thank you so much for being here. Just a couple of questions. One, can you tell us, was President Biden tested today, and has he tested negative? Do we know the last time he tested negative?
I don't know. I'm not involved in the president's testing protocol, so I just don't know the answer to the question.
He was tested yesterday and tested negative.
Okay, thank you. On Paxlovid, I just want to be crystal clear because you're trying to expand access to it, but you still say if people meet the medical requirements.
Yeah.
Does that mean that Paxlovid should only be taken by people of a certain age and who are immunocompromised, or that it should be taken by anyone who has symptoms?
No, so neither. FDA has laid out a very clear set of criteria for who should get Paxlovid. Very basically, it's anybody who's at high risk of developing complications. And the FDA points to a CDC assessment. It's a long list. I can read it all to you, but of course, age is important, presence of chronic diseases. But the bottom line is that, and what I am recommending to family and friends is, if you get COVID, you should see a provider and make that assessment with your provider. A lot more people are eligible and would benefit than I think people think.
And just very quickly, can you help us to understand this moment that we are in? Because on the one hand, cases are going up, particularly on the East Coast. As you have said, hospitalization and deaths are going down. But is the country in the midst of a surge?
What I would say is, we are going to see cases go up and go down during this pandemic as we head into the weeks, months, and years ahead. The key things that we need to be following are our healthcare systems getting stressed? Are people ending up in the hospital with severe illness? Obviously, are people dying at high rates? Those are, in my mind, the most important metrics. And right now, while infection numbers are rising, and of course we all want to see infection numbers coming down, the good news is, because of the extraordinary work of this administration, we've got Americans much better protected. And that means that we're not seeing a huge bump in hospitalizations. The deaths are still declining. Obviously, we want to continue tracking those metrics.
Thank you, Dr. Jha.